Hello, I'm Derek. I'm going to be your nurse today. Um, so we're going to be doing an abdominal assessment to check for any distension, and then we're going to be performing a catheterization. So first thing we're going to do, we're going to perform hand hygiene. And we're going to put on some gloves. All right, so we're going to start with just the focused abdominal assessment. So we're just going to pull back what we need to get to, um, just to maintain some privacy. So we have the abdomen exposed. It's a little hard to see in the video, but so we're just gonna begin by inspecting it. Um, for anything abnormal, since we're mainly looking for distension, we're gonna be looking for difference in height in the abdomen. But it wouldn't hurt to check for other things while you're already looking. So I can't see um, any height irregularities, anything that looks like distension. Um, so we're just going to move on to light palpations just to feel for distension around the bladder area. Right, everything feels smooth, so we're just going to go with some deeper palpations. And when we're doing this, if the patient is feeling any pain or discomfort, we're going to stop. I didn't feel any distension there either. Um, this is mainly what we have to do to look for distension in a person with a history of bladder cancer. So we're going to cover up the abdomen again. And we're going to put on some new gloves. All right, and now we're going to expose the area that we need to get to for the catheterization. So we're just going to lift up here. We're going to get out our catheter kit, and we're going to just set it down here. And then if this doesn't unravel before our eyes, we're just going to grab the corners and pull them back, trying to maintain the sterile field that we're going to set up. And then we are going to take this and we're going to unfold it. Again, making sure we're not violating that sterile field. We're going to place the shiny side down under them. Usually I have help for this, but it's just me. I'm going to put it here, just going to lift up their legs for them and slide it under. Ideally, the position that we'll be using is them having their legs in a frog leg manner. We're going to use this. This could either go over the area or it could be additional under the legs. However, since it is a female, we're just going to put it under the legs. So, same type of deal. Help them lift up their legs. Put it under. right. So we are going to move this part over here. We're going to set the sterile gloves over here because we don't need them because we have our own. And then we're just going to perform some pericare. So this kit comes with iodine swab sticks. I'm not going to actually clean the area right now, but what you want to do is clean the side closest to you, the side farthest away from you, and then the middle of the area down. And all of these are just going to be going from top to bottom. Just going to set that over there. And then once we perform pericare, we're going to actually get ready to put in the catheter. So after we perform pericare, we're also going to switch to our sterile gloves. And again, being careful to open these and not touch the side that will be on the outside. And we're going to get ready to put in the catheter. So we're just going to take it out. Put it on the sterile gloves. And then we are going to get the area ready to be inserted. So we're going to put the lubricant on the tray. Ideally, since the kit is a one-off, you would put everything, but I'm just going to put a little bit. And then we're going to get our catheter out. And we are going to lubricate the top of the catheter. And then insert it into the urethra. And if they feel any pain, they're going to tell us. Discomfort might be common, but we can reevaluate if they feel any discomfort. We're just going to slowly put it in. And then we're going to be going until we see urine in the tube. And then we're going to put it forward 1 to 2 inches. And then we are going to get our water ready to fill the balloon and apply it. And slowly put the water in the balloon. And then we're just going to be pulling it out until we feel resistance, which would be the balloon. And then we're going to just push it in just a teeny bit so it's not like right at the edge. So that should be good. And then we are going to take our catheter bag and we're going to be strapping the catheter to the leg so that it doesn't move around as much. I left the strap over there. This is also something that you might have a partner do to make it easier, so you don't have to keep going around the bed. So, usually one person will lift up the leg, other passes it through. And then you're just going to strap the catheter on there. And then we're going to coil up our excess after we are done with that. And clip that onto the bed. You still want to give them a little bit of excess so they're able to freely move. And then we're just going to put the bag and clip it onto the bed. We're not going to be putting it on the rails. Just like that. And then we're going to be going over just some patient teaching to make sure they know what to do with the catheter and what not to do. And then have them repeat that back to us so that we know that they understand. And then, of course, clean up. Done. But catheter is in, so we're all good.